My name is Sue Kozlowski. I'm the Director for Healthcare Consulting at TechSolve, and we specialize in utilizing a lean approach to help healthcare organizations improve their cost, quality, and delivery of services. How can lean be applied to create a more efficient and effective process for the emergency department? The ED is the gateway to hospital admissions, and the services provided to patients are varied and complex, linking in some way to most of the other departments in the hospital. So where should we start? We begin by looking at the whole value stream to understand how services flow to the patient. A value stream is similar to a service line concept. It's the flow of activities that drives value to the patient, who is the customer or recipient of services. Here you see an example of a typical ED value stream. Only the major activities are represented. Next, we look at each of these big blocks or buckets in more detail. Where are the bottlenecks and barriers? Where are the mistakes and oversights? Where are the frustrations and problems? Where are the touch points for clinical quality indicators, patient satisfaction issues, and employee engagement elements? In a typical ED scenario, we may find the following. Patients sitting in the waiting room for extended times, a dissatisfier for patients. Patient safety issues because their clinical condition may worsen while waiting. Inconsistent triage steps performed by different nurses. After going to the room, patient waiting to see a medical provider. Excessive wait times for lab tests and x-rays, and sometimes missing results. Waiting for discharge instructions to be completed and printed. Missing the collection of copays before the patient leaves, and long room turnover times. In order to address these issues, we can use the lean approach of first collecting data to see where the biggest problems are, and then by engaging frontline staff to serve as subject matter experts in a lean process improvement project. We know that every stakeholder wants something a little different in their day. Providers want to be efficient in the use of their time. Nurses want to stay updated on their patient's clinical condition. Staff assistants want to be clear about what they should be doing and when. The beauty of the lean approach is that we work together to create a process that meets all of these needs, as well as focusing on the care and experience of the patient. So, what does all this have to do with cost reduction? A key principle of lean is that if we remove wasted effort, wasted supplies, and wasted space from our process, it will automatically cost less to provide the same service. If you could enable your providers and nurses to care for 4 to 10 more patients per day by removing barriers such as searching for charts, looking for lab results, running around the ER to find people, waiting for x-ray reports, and searching for supply items, it's easy to see that you can apply that time to direct patient care instead. You end up using the same number of people to care for more patients while driving up patient satisfaction and clinical care, ordering fewer supplies and expiring fewer dated items, using less space, and directing all of that wasted effort into value-added activities. When we do this improvement work effectively, we have found the following types of improvements. Enable the ED staff to see 30% more patients without adding staff. Decrease of waiting for triage down to the goal of 0 waiting time. Decrease in time from door to provider by up to 30%. Decrease in time from provider to disposition by 25%. Decrease in time from disposition to depart by 40%. Clarification of roles and better communication among staff, and a decrease in readmissions as appropriate. One of the big aha moments that many ED leaders have is that in order to meet their targets for admitted and discharged patients, they need to have a standard expectation for the different parts of the process. For example, if you have a 2.5-hour target for discharge patients, it may make sense to break it into pieces like this: half an hour for door to doc, 1.5 hours for doc to dispo, and half an hour for dispo to depart. Then, look for ways to complete each of these phases within that time period. Obviously, the better you do at completing tasks within these targets, the better process you have for achieving your overall target for length of stay in the ED. In order to do this, the lean approach includes frontline staff who are engaged in creating the new improved procedure, along with leaders who understand policies and regulatory issues. A dashboard of metrics is used to continuously report on performance, and problem solving is incorporated as a daily event rather than allowing small problems to build up into large issues. In summary, lean is a highly structured approach that has been proven to be effective in every area that it has been applied. What's needed for success is leadership commitment to support the Lean approach, the willingness to adopt Lean tools and concepts, and expert change agents and facilitators who can guide a staff through a Lean deployment. TechSolve's partnership with clients includes knowledge transfer to your staff so you can begin to incorporate the Lean approach within your organization. Please let us know how we can help you improve your emergency department performance using the powerful method of Lean.